Are you struggling with benign prostatic hyperplasia and wondering why your symptoms aren't improving despite taking medication? Well, it turns out that some medications can actually make your BPH worse. In this video, we reveal the top 4 medications that can exacerbate BPH symptoms and make your condition even more challenging to manage. We dive into the latest scientific research to uncover the truth behind these medications and how they interact with your body to worsen BPH symptoms. You won't want to miss this eye-opening information that could be the key to finally getting relief from your BPH symptoms. From opioids to decongestants, we cover it all and give you the tools you need to make informed decisions about your medication regimen. Whether you're currently taking medication for BPH or are simply curious about the potential side effects of certain drugs, this video is a must-watch. So, grab a seat and get ready to learn about the medications that could be making your BPH worse. Don't let your condition control your life any longer. Arm yourself with knowledge and take back control of your health. Before we dive into the topic, we would like to kindly ask you to please take a moment to like this video and subscribe to our channel. By doing so, you'll be helping us to create more informative content just like this, and you'll be the first to know when we upload new videos. We appreciate your support and hope that you find this video helpful in managing your BPH symptoms. Thank you for watching, and let's get started. Start with number 1, antihistamines and tricyclic antidepressants. Antihistamines are a type of medication commonly used to treat allergy symptoms such as sneezing, runny nose, and itchy eyes. They work by blocking the effects of histamine, which is a chemical released by the body during an allergic reaction. Tricyclic antidepressants, on the other hand, are a type of medication used to treat depression, anxiety, and other mood disorders. They work by balancing the levels of certain chemicals in the brain. Although these medications can be effective in treating their intended conditions, they can also have negative effects on the prostate gland, particularly in men with benign prostatic hyperplasia. BPH is a condition in which the prostate gland becomes enlarged, leading to urinary symptoms such as difficulty starting or stopping urination, weak urine flow, and frequent urination. Studies have shown that antihistamines and tricyclic antidepressants can potentially worsen BPH symptoms by causing the smooth muscle in the prostate gland and bladder neck to contract, leading to difficulty with urine flow. A study published in the Journal of Urology in 2020 found that men who used antihistamines and tricyclic antidepressants were more likely to have urinary symptoms related to BPH than those who did not use these medications. If you are experiencing symptoms of BPH, it is important to talk to your doctor about the medications you're taking. Your doctor may recommend alternative medications or adjust your current medication dosage to avoid worsening your BPH symptom. Next, number 2, decongestants. Decongestants are a type of medication commonly used to relieve the symptoms of a cold or allergies. They work by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. However, decongestants can have some side effects, including an increased heart rate, elevated blood pressure, and difficulty sleeping. In addition, recent research suggests that decongestants may also make benign prostatic hyperplasia worse. According to a study published in the journal European Urology in 2020, the use of decongestants was associated with an increased risk of developing urinary retention in men with BPH. Urinary retention is a serious complication of BPH that can lead to kidney damage if left untreated. The exact mechanism by which decongestants worsen BPH is not entirely clear, but it is thought to be related to their effects on the sympathetic nervous system. Decongestants stimulate the sympathetic nervous system, which can cause the smooth muscle in the prostate and bladder to contract. This can lead to urinary retention in men with BPH. So if you have BPH and are experiencing symptoms such as difficulty urinating or frequent urination, it's important to talk to your doctor before taking any decongestant. Your doctor may recommend alternative treatments such as nasal saline irrigation. Next, number 3, diuretics. First of all, diuretics are medications that are often prescribed to help increase urine output and decrease fluid retention in the body. They work by reducing the amount of sodium and water that is reabsorbed into the bloodstream by the kidneys, which can be helpful for people with conditions such as high blood pressure, heart failure, and edema. However, recent studies have suggested that some types of diuretics, particularly those known as thiazides, may actually worsen symptoms of BPH. This is because thiazides can increase the amount of calcium in the urine, which in turn may contribute to the development of kidney stones and urinary tract problems. Additionally, thiazides can also cause the prostate to enlarge, which can lead to urinary obstruction and other symptoms associated with BPH. A study published in the International Journal of Clinical Practice in 2020 found that thiazide diuretics were associated with an increased risk of BPH-related hospitalization in men over the age of 50. The researchers suggested that this may be due to the fact that thiazides can raise levels of a hormone called aldosterone, which has been linked to prostate growth and BPH. So if you have been diagnosed with BPH or are at risk for developing the condition, it's important to talk to your healthcare provider about any medications you are taking, including diuretics. They can help you weigh the potential risks and benefits of continuing to take these medications, and may be able to recommend alternative treatments that are less likely to exacerbate your symptoms. Next, number 4, opioids. Opioids are a class of medications that are commonly used to treat moderate to severe pain. They work by binding to receptors in the brain and blocking the perception of pain. However, opioids can have side effects that can make certain conditions worse, including benign prostatic hyperplasia. According to the latest scientific research, opioids can worsen BPH symptoms by reducing the tone of the muscles in the prostate and bladder neck. This can result in increased urinary retention and difficulty emptying the bladder. A study published in the Journal of Urology in 2019 found that men who were taking opioids for pain management had a higher risk of developing urinary retention and needing catheterization compared to men who were not taking opioids. In addition, opioids can also interfere with the normal regulation of testosterone levels in men, which can lead to further prostate growth and worsening of BPH symptoms. Another study published in the Journal of Urology in 2020 found that opioids were associated with an increased risk of BPH-related surgery in men over the age of 50. It is important to note that while opioids can provide effective pain relief in some cases, they should be used with caution in men with BPH. If you're experiencing urinary symptoms and are currently taking opioids for pain management, it is important to speak with your healthcare provider about alternative treatment options that may be more appropriate for your condition. And that's it. Thank you for watching our video on the top 4 medications that can make benign prostatic hyperplasia worse. We hope that you found this information informative and helpful in managing your BPH symptoms. Remember, if you are currently taking any medications for BPH or other conditions, it's important to speak with your healthcare provider about any potential interactions and side effects. If you enjoyed this video, please give it a thumbs up and consider subscribing to our channel for more informative content. And as always, if you have any questions or comments, please leave them down below. Thank you again for watching, and we'll see you in the next video.